Hi, I'm Dr. Chris Miller. I'm originally from Cincinnati, where I did my training and fellowship in skull-base surgery. I've been here for 21 years now. I've been at the NeuroSpine Institute for the last 7 years since my partners and I founded this. We did this specifically so that we could provide a center that had state-of-the-art, top-quality, minimally invasive care for spine patients in particular. It's not the only thing I like to see. I'd still like to see my traumatic brain injuries and take care of trauma and ER patients and hemorrhages, but this is the majority of what people need, and it's become very sophisticated over time. The practice of spine has changed tremendously since I've been in practice. In fact, much of what we do now was only in its infancy when we started 20 years ago, and at this point bears little resemblance to where we were. That's the nature of medicine in general. It's always a constantly changing field, which is one of the challenges that makes it interesting. I knew when I went to med school that I was going to go into surgery. That's what I liked. I liked the trauma, I liked the injury part of it, and I really thought I was heading into general surgery. But when I rotated with my neurosurgery colleagues and friends, it was just almost instantly I knew that that's what it was going to be, and it's never changed. One of the things I've really enjoyed was developing treatments for back problems in particular. Lumbar fusions are a very complex issue. There's a lot of indications and a lot of reasons to be doing lumbar fusions. So I've developed a way of doing a complete inner body fusion, a complete reconstruction by reducing the size of the exposure and the amount of tissue damage, and putting the hardware in a slightly different fashion that maximizes what patients have. You focus on the areas that have the hardest bone and take particular care not to disrupt the adjacent levels. And that has had a huge impact in the outcome, the immediate outcome of my patients. And I would expect her to have considerable relief of the majority of her symptoms, which are fairly severe stabbing, buttock and leg pain, and some of her back pain will subside. I think she'll fully recover from this over the course of a month or two, but she should be walking around later today. I have done hundreds of these lumbar fusions. I've been doing them this way since 2006, and I've adapted my whole practice to focus pretty much on that technique. When I see patients, it is very helpful for the patients to know why they're here. Surprisingly enough, that a lot of patients come and they only came because their doctor told them to. And they are dumbfounded to find out they might have a problem that might require surgery. It is particularly helpful if patients come prepared, much as I need to be prepared. That means we need to be sure that we have all their images, meaning their MRI scan or CAT scans or x-rays. And to some degree, it's very helpful to have their doctor's referring notes.